hello there. Please take a seat. My name's Dr. Sarah. How are you today? Good. That's good. Okay, before we begin, let me just get the notes. I was just having a little look through before you arrived. So just confirm your name for me and date of birth. Okay, that's fine. And your current address. Great. Okay, that's fine. Okay, so you're here today to try our acne scarring treatment. Okay, I'm just having a look down now. You've had a long history of cystic acne on your cheeks particularly. Yeah, okay. And I can see just by looking you do have some scarring there, so you wanted to try the treatment that we're now just beginning to offer. Yeah, okay, that's fine. So what will happen, I will cleanse your face and I will take a close look with my magnifying glass and light and have a look around your skin, okay? Just to see that it's actually quite calm now, that there's no inflammatory lesions at the moment. Alright? Okay, and when we've done that and everything's fine there, okay, I will inject a little bit of local anaesthetic just into the areas that I'm going to work on. Purely because the light therapy that we'll be using can make your skin feel a little bit warm, or sort of almost on the verge of feeling like sunburn while the treatment goes ahead. It will calm down afterwards, okay? I've got some special spray to put on afterwards. Yeah, but we just don't want you being uncomfortable in any way. Yeah. So have you got any questions for me? Yeah, the redness may last for maybe a day or so afterwards, but it'll be very, very faint. But we would ask that you don't go out in any sunlight, okay, for at least 48 hours, and then put sunscreen on when you do, which of course we should all do anyway when we're outside in the sun. Okay, so you've stopped all your acne treatments now, have you? Okay. So when was the last time you had a bad outbreak? Okay, so it's been several months now. All right. It was more prominent during your teens and 20s? Okay. That's fine. All right. So firstly, I'm going to put my gloves on and I'll pop a little cape around you, just because I'll be spraying some solution and we want to keep nice and protected. Did you pick your acne? Most people do. And obviously this can push the infection further into the skin and cause larger inflammatory lesions and cystic lesions, which then if you pick even more, they tend to go deeper, larger, they can kind of join together and you end up with very, very deep, hard lesions, which can lead to very nasty scarring, redness, pitting, that kind of thing, which you have a little bit of on your cheeks there. Okay. So I'm just going to pop a protective gown around you, so you're nice and comfortable there. Good. There we go. Let's just pop this around you. you're all good. Okay. So, what I'm going to do first is I've got some nice cleansing and cooling solution, and I'm going to wipe over your skin with this. Okay, just relax there. Let me just wipe. It does feel nice, doesn't it? Very refreshing. Okay. Alright. Okay. Let's do some more on this side. You all right there? Okay. Down. Okay. Down your nose. Right. That's fine. So firstly, I'm going to gently press around the skin to see what I can feel underneath, if that's all right. Okay. So just gently, just keep your head nice and still there. This won't hurt. So just gently going to press just around the cheek area where you do have this scarring. Okay. And on this side. Okay. Let's just go around your face a little there. That's the top. Okay. I can feel there's some slightly old scarring underneath your skin. Okay, just around this cheek area, which is obviously where you've had the most inflammatory lesions. Alright. So I've got a special magnifying glass here. I'm just going to look with this and with this light. If you'd like to just close your eyes a second. I'll try not to shine it in your eyes, but I'm obviously going to be quite close to the eye area. Okay. Okay. Just taking a nice close look at this. Alright. Okay. And just on this side. Just looking closely so I can see a more detailed view of your skin. Let's have a little look down here. Okay, that's pretty clear and just up the top. Alright. Okay. So it really is just the cheek areas that we need to treat for the scarring. Okay, so I'm just going to jot a few notes on what I've just seen. Alright, so it's both sides. Okay. So what I'll do next is I'll inject some local anaesthetic just into a few points on each cheek, only small amounts, just so you don't feel anything when I have the special light on the areas. Okay. Alright. Okay. So, just got the syringe here. Let me just get that there. So I'm just going to pinch the skin a little bit and give it a little bit of a wobble just while I inject it, okay? That will make it feel more comfortable. You'll just feel a little scratch as it goes in. Okay, we'll start with your right cheek first. Alright? Okay, so a little pinch there and a little wobble. And there we go. Okay. And again, little pinch on your skin. A little wobble as I just inject a little bit of the numbing medicine in there. Okay, you all right? Okay, and just one more here. Okay, little pinch and a little wobble. There we go. Okay. All right. Okay. And I'll do the same on this side now. Alright, so just a little pinch and a little wobble, and in we go there. Okay, lovely. And just a little bit more here, little pinch and a little wobble, and there we go. And one more. Okay, just in this area there, pinch and wobble, and there we go. Okay, that's perfect. Okay, so that should be numbing up nicely for you now. Yeah. Okay. Right then. So what I'd like to do first is I just need to just measure the area. What I'm going to be working on, I just have a little tape measure here. And just keep nice and still for me. Alright, so I just need to. Okay. Alright. Make sure that's okay, and a little bit more on that side. That's fine. Okay. So how's this feeling now? You good? Okay. Rub those little drips. Alrighty. So I'm just going to check that you can't feel. So can you feel that? No. And that. No. That. Okay, that's great. We're on that side. And there. Yep. Okay. That's fabulous. Absolutely fabulous. Okay. So we're all nice and numb there. Make sure I've got all my tools, which I have. So just get my light. Okay. So this will shine different colours, okay, as it's healing the skin. Alright. So you keep very, very still for me. If anything feels uncomfortable, do tell me. Okay. So I'm going to start off with a blue light, this blue light here, okay, and I'm going to be shining this just on this area, okay, on your right cheek. Alright, so here we go. You shouldn't feel anything because you've had the anaesthetic, but please tell me if you do. Okay, alright. Very gently, just going over the area with the scarring. Okay. Okay. Just checking skin there. Okay. And just on this side now. Okay. Just aiming that light at your cheek area. Okay. Alright. Okay. Are you feeling alright there? Okay. You can't feel any heat? Alright. So now the light will change to a green colour. Okay. So just relax as before. And I'll just be aiming this at your cheek area. Okay. Keep your eyes closed and your head really still for me. That's great. Doing really well. Okay. Okay. And Just on your left side now. Okay. Alright, just making sure we're in the right area there. Okay. You're doing really, really well. Really, really well. Okay. Just check over here now. Okay. Is that still feeling all right? That's fine. Okay. So the final colour is red. Now this is the one that makes it feel really quite warm. If you do feel anything unpleasant, please say. I can always give you some more anaesthetic. Alright, just keep nice and still for me. Okay. And I'll just go over the cheek area. And on this side, let's just double check you're okay there. Just going over that cheek area. You're doing so well. Is that still comfortable for you? Good, good. Okay. Just like to keep your eyes closed. I'm just going to have another look with this light. Okay. Now I can see more closely. That looks wonderful. Normal amount of redness that's expected there, but that looks good. So let's just have a look over here. Just going to gently press on the area. Okay. Well, that looks wonderful. What I'm going to do now is put some nice cooling spray onto the area, and that will help reduce the redness. Okay, there we go. You feeling okay? That's fine. Now you're going to feel numb for a little while longer, probably about an hour. Okay, I recommend that you just take some paracetamol if it feels a little bit uncomfortable, which it may do, but do stay out of the sun, won't you? Right, so let me just update your notes. I'll give you a call tomorrow and we'll see how you're doing. If things don't feel good later, you can always call in and then we'll get you back in soon to have a check and a possible second treatment. Okay, because often it needs more than one. Your scarring isn't the worst, but it's definitely built up over several years, so you may well need one more treatment at least. Okay, but I do want to make sure that you're reacting okay to it because it's a very new treatment. All right. And on your way out, if you'd like to pop to reception, okay, the receptionist has got a special cream and the cream just needs to be applied when you get home, okay, and then before you go to bed, and then 3 times a day for the next 2 days. Okay, so just when after you've had a cleanse in the morning, gently cleanse, then midday and evening, just pop the cream on the area very gently, just pat it in. Okay, just pat like that. Don't really be harsh with it, alright? Okay, and that will help with the slight dryness that may arise, okay, from the treatment. Alright, well, it's lovely to see you today, and I look forward to speaking with you tomorrow. And if we do need to see another treatment, then we'll get on to that. Probably leave it about 2 weeks, okay, before we do another treatment maybe. But we'll have a look at you and see what we think. It's hard to say from the outset, but we just need to check as we go along so we give you the right course of treatment. Okay? Alright, well, you enjoy the rest of your day. Take care. Bye-bye.